Being here. Amanda unfortunately couldn't be on, but I just wanted to jump on and we have quite a few people that have signed up. So almost 60 people have signed up. Eric, you are a hot commodity for everyone. So I just want to introduce Eric Wright, who is part of our family resource team, and I will let him tell you how long he has been doing that. But we are incredibly grateful for all of the information that Eric provides for us. I know I'm Catherine Ely. I'm the family resource director here. My son is 11, and I remember a meeting with Eric when he was 2. So it's been a long time that he has served our community, and we are just beyond thrilled to have you. So thank you for doing this, for hosting this, and for being a part of it. So you should have access to share your screen. If anyone wants to, let's see, there is a chat in there. So if anyone would like to put anything in there, you can either select to have it to everyone or just to us. And I can make sure that that gets either, if it doesn't get answered tonight, if it's too personal, we'll make sure that we get followed up with you guys. So feel free to do that as you wish. And I'll let Eric take it over.
Thank you. First, can you see my screen?
Yes, we can.
All right, great. Am I coming through pretty good? Pretty good connection?
Yeah.
Okay, great. My name is Eric Wright, and I'm a past board member and presently a family resource member for the Angelman Syndrome Foundation with an expertise in insurance, I believe, advocacy and resourcing. And so today, I'm going to share with you some of my tricks that I think are really important. And so as I go through this, I'm going to encourage you to please chat with me, and I'm going to encourage those people that are chatting to make sure that if I don't respond to it, we'll take time at the end to ensure that we have opportunities to talk about some of your questions. So I'm delighted to have you here tonight. And let me start by saying I'm a fervent advocate, a parent of a daughter with Angelman syndrome who's 18 LC. I have a wife who's heavily involved with the foundation as well. My other daughter is adopted, and she's 21, and she has cerebral palsy and a diagnosis of autism. Both our daughters have a diagnosis of autism. And so my objectives for this is, well, let me tell you too, I also have a son who's swimming tonight, and that brings me to where I'm at tonight. He's in the middle of a swim meet. He's a very competitive athlete. He's 15. And so it brought me to the closest location I could get to get a good Wi-Fi signal with a friend who lives close in this area. So my objectives of the presentation tonight are you to have a better understanding of health insurance benefits, really specific to Angelman syndrome, to be better equipped to advocate for access to health insurance benefits and improve the quality of life for all the beneficiaries of it, and to have knowledge of key advocacy groups within your own individual states, which can really help you navigate the system of Angelman syndrome and access to insurance. So those are my objectives tonight. Let's first talk about Angelman and developmental disability. This is important because if you're new to this or if you've been around, Angelman is obviously under the compassionate allowance. I want that to be well known to anybody that I talk to, as designated by the Social Security Administration. And what that means is that when you go to apply for benefits and you talk about what your child's disability, if you mention Angelman syndrome, there's a compassionate allowance to expedite that request for any type of services, whether it be Medicaid in a waiver program, whether it be supplemental security income and qualifying at either income requirements below the age of 18 or as they move to adulthood at the age of 18. And because Angelman does qualify as a developmental disability, it's something that has manifested way before the age of 22. and it's likely to continue indefinitely. Now, that's hard to hear sometimes as a parent, but as we go through this journey together, we have to navigate those resources to buy, despite what it is. Angelman syndrome is a developmental disability that does qualify under the compassion allowance. Why is this important? Well, I want this to be known to you so that when you go and you talk to people, that you can actually say, look, I talked with an expert who is on a state Medicaid board and has navigated some challenges through his own state, but I understand that Angelman does meet the qualification of a compassion allowance. So correct me if I'm wrong, you might have to ask them. You do realize that means that you expedite this claim once you have that diagnosis in place. And unless they're lazy or don't want to do work, they should be able to understand and be able to research that that does qualify for expedited claim. Now, let's talk about insurance. This is an area of where we're going to spend a lot of time tonight talking about primary and secondary insurance, which is really private and Medicaid, and what I'm going to be speaking about tonight. So when we start thinking about private insurance, I want to talk about autism. The reason I bring this up is because in an article that I read years ago by Steffenberg and colleagues in 1996, when it was published, that individuals with Angelman syndrome have a high rate of autism based upon a standardized score for screening for autism. Now, why is that important? Well, because large group insurance providers with an autism diagnosis and Angelman syndrome are mandated to provide ABA therapy for individuals with autism. That's according to an article that came out in 2009. Matter of fact, I'm very well versed on this because in 2017, I had to bring forth a case to the Commonwealth of Kentucky about Angelman syndrome and autism, which highlighted Anthem, which was at that time had been sued because of a denial of an autism benefit to a child with autism, and they lost in a court of law, which further stipulates that now those regulations are in place and your state has regulations that can be reviewed at the 3 websites that I highlight here. So I will provide this information to our members of the Angelman team and make sure that you have access to this as well following the seminar here tonight. So private insurance, that's critical. Large group insurance. What is a large group policy? A large group policy is a policy that has 50 employees or more. And if you work for a company that has a large group policy, you're paying premiums, you qualify for an autism benefit if you have the diagnosis. If not, I would suggest you seek out that diagnosis as a comorbid diagnosis so that you will be able to access some additional resources. Now, Medicaid and Angelman syndrome is another topic that I'm very, very well informed on. Individuals with Angelman syndrome do qualify for Medicaid waiver programs. Now, you're saying, hey, Dr. Wright, what's a waiver program? Well, these programs are offered through the Cabinet for Medicaid Services, for your Department of Medicaid Services and your community-based services providers within your state, and they're called 1915C waivers. Now, I'll talk to you a little bit about what that means, but for more information, you can find out about Medicaid and home and community-based waiver services at the link that I provide in this presentation. This is critically important, folks. This is probably the biggest benefit you can get is understanding that you do qualify for a waiver. Now, whether you qualify for that waiver from a specific age in your state, like typically the age of 3 and beyond for children, or some stipulate 18 and older. But be mindful is that your levels of waivers exist within your state, and waiting list and advocacy are very much a big part of what you have to do to navigate that process. So each state provides what's called levels of care for families and individuals with Angelman syndrome and various other disabilities based upon a need. Angelman syndrome meets typically the highest level of support required. It's important to note is because you can actually be on a waiting list for another 1915C waiver, even if you were at the beginning of a lowest level waiver and moving to the next level and then to the highest level, which typically includes residential services. But be forewarned, they have long waiting lists. Also, it's important to get on these lists as soon as possible. So if you're not, let me give you a suggestion. It's critically important that you do get on that list. Now, I see the team has already said I will email everyone this week with Eric's presentation. So that's great. Thank you for putting that out there, Amanda. So now, as I suggested, you can obtain another level of waiver support and service while you're waiting on a more comprehensive waiver. And so I say it's like the hierarchy. You got level 1, level 2, level 3. I use a car analogy when I do these presentations at the conferences. Your Kia is a very functional car that gets you to point A and B, and that's your level 1 waiver. You step it up when you go to maybe a Honda Accord, and that Honda Accord has 4 doors. It's a sedan. It's got maybe some leather seats. It's got the bells and whistles. That's a more comprehensive and with a little bit more features to it. Your top level is going to be like your high level Mercedes Benz or your your Tesla that's fully loaded, right? So that is a high level waiver that's got all kinds of bells and whistles, including residential services. So you can be on the level 1 waiver while you're waiting for both level 2 and level 3. And extending that too, if you get on level 2, you still wait for level 3. But you just need to make sure you get your name, find out what your waiver names are because they vary state by state, and make sure you do your research to ensure you're on all the level waivers based upon your needs at this time. So let's move along here. So still talking about level waivers, waiting list, and advocacy. One of the big services provided by most all waivers include respite care. Now, the truth is respite care is hard to come by, but having respite care is critically important when you get opportunities to have it. I particularly am thankful for the opportunities I've had to utilize respite care for my wife and myself multiple times. We have a rule that we try to do at least a date once a week where we're sitting at a table alone, away from our children, and somebody's serving us something to eat rather than us being a care provider for our children. And that's one of the primary benefits of a waiver. The secondary is personal care support and attendant care. Now, personal care support is just that. It is providing anything that would be required of a child, from hygiene to medical to financial to transportation to medical appointments to bathing, washing, feeding. Any of that type of stuff comes into personal care. And so those services are often provided by higher level waivers. Maybe level 2 may include some additional things like community living supports, which means you can have someone who takes your child out into the community and allows them to be part of the community with support, or a job coach as your child gets older. Case managers to help you manage your Medicaid program, and environmental supports, which are minor home adaptations, or maybe even a device for AAC. Now, again, these vary state by state, but they typically are provided by the second level waiver. And at the highest level, it includes all of the above services, but includes residential supports, along for funding for 24/7 residential care, including staff residents and group homes. Now, that is a challenge to folks because those are difficult to come by, but they're not uncommon. You just have to be able to navigate that. And being on that waiting list for those supports is necessary. So again, be on level 1 if you get there, go to level 2 if you get there, and take level 3 when you get it, and just be thankful for when you have it. Now, the focus of these home and community-based waivers is to provide support and services within the individual's community. And what we're speaking about here is our children or our loved ones that have Angelman syndrome. So those are what the waiver are intended to provide, supports within the community. Now, there are typically two ways to receive those supports and services. A traditional provider, which is an agency that is hiring their own individuals to provide those services for your child or loved one, or person-directed option, which means you as a representative or them, you as their representative, you get to hire, fire, retain individuals that can provide that level of care for your child or your loved one. And you can also blend those services by providing a traditional side of the waiver, which may be ABA services, with a person-directed option as well, and that's called a blended plan. Now, the purpose of person-directed options allows the individual within the family, again, to direct the services which impact their quality of life, such as personal care, community living supports. And you get to hire those people and pay their wage, and you're in control of their budget with a case manager or a fiduciary agent who actually provides their payroll. But regardless of how a plan of care is often developed, they are typically always developed through the process of person-centered planning, which means keeping the individual, in this case, a child or adult child with Angelman syndrome, at the center of the process. But you also have to always be mindful that planning for the future is critical. And Medicaid is going to be a key component to that later in life. All right, so let's move along. And then after this next slide, I'll take a brief break and just answer any questions that might have come up to this point. Now, so let's talk about additional Medicaid information, which this is an area that's insurance is Medicaid. Medicaid is, again, a waiver is what we qualify, vary state by state. Now, some people ask, Dr. Wright, what does it mean to qualify for a waiver program? Well, some states do apply the 300% above federal poverty rule, and that could be for a family of 5, could be $104,790. But medical and institutional deeming is another criteria, which is often, if not almost, the rule of thumb for most state Medicaid plans. States consider a child under 18 as if they are in ICF, intensive care facility for mental retardation. I know that's horrible to hear that, but that's what it is for, facility level of care, which would be institutionalized care, and do not count your parents, us, or loved ones' assets or incomes when it comes to applying for Medicaid. Let me state that again. They don't count it. Because Angelman syndrome does meet what's considered to be ICFMR criteria. So most likely both children and adults qualify for waivers based upon income or medically institutionally deemed necessary. But it does vary state by state, and it's important. It's critically important to say there are waiting lists in each state. The sooner you're on that list, the more likely you're going to get the service. Delaying it just delays getting access to something that is vital for the future planning of your child with Angelman syndrome. And guardianship becomes an important topic at age 18 to 21, and each state has its own specific procedures for applying for guardianship for an adult with Angelman syndrome. Now, we've gone through the process twice in the state of Kentucky, and we had to just go and pay a filing fee in the court, and we represented ourselves, but our daughters had an attorney to represent them. And based upon what we presented to court and what they presented, that was a very seamless process. Now, some people apply for conservatorship. That's perfectly fine. Those are things that I would recommend. Regardless, it doesn't keep you away from Medicaid. Medicaid is a right that is part of the process of having a child with qualifying with an intellectual disability, particularly with compassion allowance. Now, I'm going to stop here and see if there are any questions at this point. I don't see anything in the chat. Okay, we're gonna move forward. Oh, there's a participant that raised their hand. Let me see what we got here.
Yeah, we have Tiffany has her hand raised. If you'd like to, yep.
Well, the chat's not is disabled.
Oh,
Well, your problem.
okay.
Thank
Well,
you. I'll work on trying to get that enabled.
Tiffany, thank you
Okay,
for
thank you.
sharing that. Tiffany, did you have a question?
I do have a question,
Okay,
actually.
Tiffany, what can I do to
Um,
help you? Yeah,
so my son is on state um health insurance, so Medicaid, state Medicaid in Washington State. Is there a difference between that and the Medicaid waiver?
there are. Yes. So in each state you have a Medicaid plan, and state plans are typically what's considered to be MCOs, um, managed care organizations for Medicaid. A lot of that is part of the um, Obamacare provision, providing Medicaid for individual families. Waivers are completely different. They're administered through your cabinet for Medicaid services, but it's specific for individuals that meet the criteria of ICFMR facilities. It's it's imperative to get both in place. Okay, so it's a great question, but they are different. Okay,
Does the Medicaid waiver, would that cover out of state services then? Because we're trying to go to the Colorado Children's Hospital to see to the Angelman Clinic there, and I don't think our state insurance is going to cover it.
that varies state by state. So I'm not an expert on what Washington covers. In the state of Kentucky, we are blessed with the Medicaid plan that does cover some co-payments that are not covered by our private insurance when we go to Mass General Hospital in Boston annually. So I can answer from an expertise standpoint that in Kentucky, yes, we do have the advantage of having co-payments paid, but I can't answer for Washington. But I
So
will be
that's
able
not what the Medicaid waiver would cover. That's something different.
waivers and Medicaid are essentially the same thing.
Okay.
Medicaid is a waiver is a Medicaid plan, but it's administered different than your MCOs. Okay, so it's Kentucky, like in Kentucky, it's straight Medicaid, and then we have MCO plans that are managed through like Anthem or Passport Services. Offer our two plans. Actually, Anthem is leaving the state for our MCO, but Passport and two other providers are still here. So they are different. Let me just emphasize one thing. Ensure that you have applied and are on a Medicaid waiver 1915C waiting list at all levels, regardless if you have Medicaid as your primary insurance through your managed care organization. Okay. And I will give you some resources on how to find out what is covered state by state later in the presentation. So thank you, Tiffany, for that question. Let me go to Samantha. Samantha, go ahead.
I've been up from the beginning. If she doesn't come on here. I did see, so the chat's not able, but there's question and there's a Q&A on there if anyone wants to do that. And Maddie actually asked, so should we get on a waiting list for Medicare if our child is young, 3 years old, and covered by private large group health insurance? I don't know if she wants to hop on.
Let me just clarify two things. It's not Medicare, it's Medicaid. Okay. And I want to make sure we differentiate those two things. So yes, and the answer is yes. And let me say it again. Yes. Let me say it one more time. Yes, get on any waiting list, anything for any Medicaid program, and I'll tell you reasons why it's critically important. Okay. Good. All right, let's move on. All right. So because Medicaid does provide mandatory federal benefits, and this is one of the reasons. But the other big thing is early periodic screening, diagnostic, and treatment services, particularly for individuals under the age of 21, which is medical and surgical clinical services as well, and anything that is considered to be medically deemed necessary or by medical necessity. That's a critical aspect we're going to talk about here. We're going to talk about a new resource that I utilize when I'm working with families quite a bit. Okay. So these are federal. There are optional programs as well, like prescription drugs. It's optional. Most states carry it. Clinic services, optional, but most carry it. Dental, optional, and vision, optional. But to be quite honest, these are almost always carried and covered in state Medicaid plans. So let's go back to Medicaid and children under the age of 21 or 22, really, which is early periodic screening, diagnosis, treatment program. This is critically important because by law, if you're on a Medicaid plan and you are under the age of 22, if you have a clinician licensed practicing within your state that sees your child, or even out of the state for that matter, and they make a recommendation for something for your child that's not covered under the typical Medicaid plan, it's required to be covered through EPSDT, which is a separate branch of Medicaid that is covered in your Medicaid state plan, federally mandated. A perfect example is, let's say a speech clinician suggests you need an AAC device. It may not be covered under typical Medicaid waiver plan, but if a speech clinician with the assistance of a physician suggests it's necessary for communication, it is required to be covered by law. Now, they're going to deny it probably, but we're going to talk about the appeal process and how to go through that. But the truth is, it is required by law under EPSDT, which is if you're on Medicaid, you get EPSDT if you're under the age of 22. Very, very important process and arm of Medicaid, particularly for younger individuals. So, and here's the thing, EPSD from Health Resources and Administration of Maternal Child Health is where it comes out. There is no federal definition of preventative or medical necessity, or an amount or duration and scope of rules that really limit what must be covered. It's as simple. The purpose is to prevent the onset or worsening of a disability and illness in children. And so it's covered because if it's written to say it's going to limit a child by not having this, or it's going to worsen their condition, they are required. And in Kentucky, an example is PT, OT, and speech therapy. We may be limited to a certain amount of visits with our Medicaid plan, but through EPSDT, we can get it once a week because a clinician has suggested it's going to help provide the services our child needs. So, another key component of this, and this is when I say to all of my families at the conference, if you get hip in your state because of me, you have to buy me a drink at a conference, okay? Because HIP is a Medicaid program that if you get Medicaid, you have a primary insurance provider. The health insurance premium payment program is a program that allows a recipient's family to receive free private insurance paid for entirely by their state Medicaid program. So let me give you an example. Kentucky. All right. I have Anthem EPO through my policy at the University of Louisville. I pay for my entire family, and my family plan premium is $673 a year. Because I have Medicaid and a recipient of Medicaid in my home, I applied for health insurance premium payment program, and they pay my premium for me by a check every month. That's right. Medicaid pays my premium every month, $673. Now, that's huge. That's enough to pay for a conference. I mean, you could go to a lot of Kalahari resorts with that. You could do a lot of stuff. So if you're there because you get hip and you're on Medicaid next time, find me. You owe me a drink. And I can tell you that I've had lots of people offer me drinks at conference because of this. You have HIP programs, and it's part of the Omnibus Budget Reconciliation Act, or OBRA 90, which authorizes states to implement a HIP program. Now, you might be saying, Eric, why are states paying premiums for? Because they want you to stay on private insurance so that Medicaid is considered the payer of last resort as secondary policy. Makes sense. So even if you leave your job, you pick up Cobra, they'll often pick up your Cobra while you're in transition to another position. You heard me right. They'll pick up Cobra. Often those payments run into the couple $1,000 to $2,000 range per month. True story. Okay. So often the case, I get a question, but Eric, what if I get a denial from insurance? Well, answer includes this. Now, I use this acronym. This is my new favorite acronym. I'm doing well on time, by the way. This is great. I developed this acronym. It's called the ASS acronym. Okay. You don't have to be an ass, but let them know you're going to be a pain in theirs until you get what your child, or it's supposed to be your child or loved one needs. So I've developed the ASS acronym. Okay. Because you're going to need to be a pain in the people who are denying your insurance coverage. And the A stands for appeal. You appeal using resources at your fingertip. Write letters, use artificial intelligence, get medical necessity letters from providers. Appeal, appeal, appeal. Okay. Next, seek help. Ask another parent, guardian, or advocacy group in your community. Talk with your insurance provider and ask about process and coverage. Reach out to your state legislators for help. Find community resources in your area which help with your medical needs, such as like United Way, Shriners. Seek help. So A, appeal, S, seek help. And the final S is search to solve the problem. Just be present in the moment. Take care of yourself and help so you can, help those who need you to take care of them. But show perseverance and resilience by searching and searching and searching and not quitting. Because the truth is, they don't make a guidebook for every state, every circumstance, or for the next person you're going to talk to at an insurance company. You are going to need to ask, seek help, and search to solve the problem when you get a denial from your insurance, because they happen. I got a chat that came through, so go ahead. From Ashley. We are starting the appeal process for our 2-year-old daughter. What things do you recommend that are helpful for providing why a toddler should need a waiver at this age? They denied her and put her on I can't read the last part of it. They denied her and put her.
They denied her and didn't put her on the waiting list, as services can be covered by other providers.
Okay, so first, need to know the state. Don't know the state yet, but that would be a critical thing.
Sorry.
So
I'm in Ohio.
Ashley, let me ask you some quick questions.
Yes.
Make sure I understand. Were you appealing for them to receive waiver benefits, or are you appealing for them to receive certain type of coverage?
So we started with our county board of disabilities to get on a waiver. We were looking at a level 1 or an individual 1 for Ohio.
Okay.
And
Katie Beckett waiver, I'm familiar with. Yep.
So we were denied, as they did say she qualifies for a waiver, yes, but she can get services through other providers at this point in time, and didn't even put her on a waiting list.
And
so
they probably won't until she's age 3 or older.
Okay.
Because they're going to suggest to you, Ashley, that at the age of 2, you have enough natural supports or what's called early intervention services in place in your school district that you have everything you need. However, if there are significant needs, you need to reappeal. Like, for example, if there was a feeding tube, appeal. If there was consistent hospitalizations from seizures, appeal. But I'm going to suggest to you, appeal no matter the circumstance. And I would suggest that you don't be hesitant to appeal. Okay.
Okay. Yeah. Because we haven't appealed yet. I have already reached out to our providers for letters. We haven't had hospital stays in regards to Angelman. She doesn't walk, she doesn't talk, but she doesn't have seizures yet. So she's not as medically complex, I feel like, as some 2-year-olds might be with Angelman.
Yeah. And that
So
was the case for most. Yeah.
we are in the process of, I need to send the appeal. But I've already reached out to the provider saying, hey, I'm starting this process.
Great.
I need letters from you guys. So that's where I'm at in that. And she'll be 3 next year.
Perfect.
So figured, hey, if we're gonna start this fight, might as well start it now. But yeah, since she's not as medically complex, it's more of a, yeah, I mean, I don't need as much as some people that have a G tube and constant seizures and all of that kind of thing. But it's really hard to be like, she needs all of this care when she's still 2 and I can carry her around and whatnot. But I think in regards of a child who doesn't need as much medical support, what are things that you see are beneficial to help get the waiver appealed and all of that? I guess.
Are you ready? I'm
More of my
going to
question.
show you. Okay. Are you ready?
Yes, I am.
So, have you used artificial intelligence to help you develop an appeal letter ever?
I have not. No.
How about I show you one? Okay. And actually, so this is an appeal example from an AI generated appeal letter. And this is really a hypothetical stipulation that Anthem Blue Cross and Blue Shield denied a safety sleeper for my daughter. And so this is the appeal letter that AI generated for me as part of that appeal process. And so you can read it here. I'll read it along. Dear insurance provider representative, I'm writing to formally, which you need to make sure, appeal the denial of coverage for a safety sleeper for my daughter. We'll say Elsie, which is my daughter, has been diagnosed with Angelman syndrome. This specialized bed is not merely a convenience, but a medical necessity for her safety and well-being. Critically important to reference medical necessity. And then you let them know a little bit about Angelman syndrome. Angelman syndrome is a rare neurogenetic disorder characterized by severe developmental delays, lack of speech, seizures, and walking and balance disorders. Due to these challenges, Elsie is at a significant risk of injury during sleep. She has a history of nocturnal seizures and frequent nighttime wandering, which pose serious safety concerns. The safety sleeper provides a secure and enclosed environment that prevents falls and wandering, ensuring Elsie's safety throughout the night. This equipment is essential for preventing injuries and providing peace of mind to our family. Without it, we face constant anxiety and the potential of serious harm to our daughter. We have consulted with our daughter, Elsie's healthcare providers, including her neurologist and occupational therapist, who have all recommended. Hang on just a second, too. You can get something, a dessert. Yeah, neat. Okay, yeah. Not a big, but get something to eat. Yeah, sorry. My son's coming in from his swim meet. He's gonna get something to eat, you guys. So, sorry about that. All right, back to this. We've consulted with our daughter's healthcare providers, including her neurologist and occupational therapist, who have all recommended the safety sleeper as a critical component of her care plan. Enclosed are letters of medical necessity from our healthcare team, detailing the importance of this equipment for her safety and health. I respectfully request that you can reconsider your decision and approve coverage for the safety sleeper. This equipment is vital to Elsie's safety and quality of life. We appreciate your understanding and prompt attention to this urgent matter. Thank you for your time and consideration. Now, I just literally put this in today, and I put in, write me an appeal letter for my daughter who has Angelman syndrome for a safety sleeper bed. And this is what it generated. That's how easy it can be. Now, is it always going to be perfect? No. Do you have to read it and make some changes? Yes. Did I? 100%. But it wasn't much. So I'm giving you a new resource for writing appeals. Use artificial intelligence. Why? Because artificial intelligence takes what is typically considered to be the most utilized representation of appeals. Well, this is a well-written and well-crafted document, and it's also very well it's grammatically correct. It's going to find you exactly what you need. And it honestly takes a little bit of a time out of the process of writing the appeal, but make sure you have the other components. Letters of medical necessity, critically important. and documentation of the diagnosis. Those are the two big things. This is really, really important. And one of the things I definitely am going to start sharing. So now, somebody asked about Washington State and Colorado and other states. Well, that's what the S is. Remember, A is the appeal. The other S is seek help. Use your developmental disabilities councils and your state agencies. These state and territorial councils are all within each state, federally funded by the DD Act. All you have to do is look in whatever state it may be. For Commonwealth of Kentucky Developmental Disabilities Council includes representatives of 16 people who are experts in their respective fields or parents that are there for a reason. And their reason is they support people with developmental disabilities like Angelman syndrome. Ask for their help. Or then use the University Center for Excellence on Developmental Disabilities Education, Research, and Service, which are called UCENS. In the state of Kentucky, it's UK. In your state, it could be Utah. It could be Washington State. It could be University of Colorado at Boulder. Whatever it may be, don't be afraid to seek out help. Or go to your federally funded protection and advocacy systems and then find out what their projects of national significance are and get help. Take advantage of those resources and get that help. Now, each state has P&A, which are protection advocates. Their whole purpose is to protect and advocate on behalf of individuals or persons with developmental disabilities. And they include attorneys. That's right. Legal services. You might need them. Don't be afraid to call your state's protection and advocacy if you're struggling.
Can I get a
Hang on just a second. Just
cucumber sandwich with the side of phosphorus? Thank you.
Thank you all for being understanding. And then last, know your national and state ARC chapters. ARC of the United States is an organization that's been around forever, and I've partnered with them on countless things. And they were people who sought out advocacy within every state. It started off as a national chapter. Now it's moved into 39 states with 730 local chapters. Be familiar with those people because they have an executive director and board members who are experts in advocacy. Now search to solve a problem. So this is AI generated. So I did a search AI to solve a problem. And then, or search Google. That's the last letter of my, remember my acronym is ASS, meaning you don't have to be one, but make sure that you can be a pain in somebody's if they don't get you the help that you need. Okay, right? So search AI, search Google, search on social media groups, search AS websites, search to be able to get you the help that you need and keep asking. No does not mean no. No often means that people don't want to do the work, right? So don't take no for no. Find out from a parent who's lived your journey and what they're getting, and then keep searching some more. So here are some resources that might help you find coverage for a safety sleeper with your child. This was AI generated, by the way. Very first organization I'm proud to say that came up was the Angelman Syndrome Foundation, which, by the way, has an article on how to cover a safety bed for your child. And it's literally a full article on how to get a safety bed for your child. Or then go to the provider itself. This was next, Abrams Nations, who's been at our conference many times. And they talk about their customer care team. They'll help you walk through the process as well. Or Safe Sleep System. This is another resource. It's on the Angelman Syndrome website. So kudos to ASF as being one of the main resources that came up when people were searching for resources. Now, hey, listen, I've shared with you some really key information, and I've talked with you about my most important acronym is ASS. That's appeal, seek help, and search to help you navigate the process of insurance, because that's what you're going to need to do. And I'm going to tell you, as a parent, I am going to advocate that you continue to do that. Now, what I'm going to do for the last 10 minutes is just open this up for like a dialogue. Let's talk. And I may not know all the answers to your situation, but I'm going to encourage you to be an ass about it. And that's going to be appeal, seek help, and search. So, all right, let's go. Nadia, go ahead.
Hi, can you hear me?
Nadia, I can't hear you. Go say it again.
Hi, this is Nadia.
Nadia,
Um,
hi.
Hi, Dr. Wright. I actually have spoken to you a couple of times.
Yeah,
Thank-
great.
Um, so I feel like I'm kind of hitting a wall with trying to figure out individual insurance for my daughter and myself. Just to recall, in terms of, we are currently on my late husband's Cobra insurance, where we have private, primary and secondary. And basically, our primary insurance has told us, do not call the state program, because they'll immediately, since they share the database with Medi-Cal, which is Medicaid.
Yeah.
Our option of her being on a primary insurance to have more options with providers will basically go away. I have spoken with our clinic as well, and they basically just can't fund. Their wait list is full in terms of kids who are on Medi-Cal. So I kind of really don't know where to turn. It sounds like HIP for California has gone away and it has become covered California. And
So
I,
they wrote it into another program. Now, let
yeah,
me tell you something else. Somebody suggested recently, they did a research, and I knew Indiana, by the way, had a HIP program. And the person researched HIP and was told, no, no, no. But guess what? There's a HIP program in Indiana, and she just found out about it because the person who wanted to tell her no is mostly worried about what? What do you think?
I'm brain dead.
Anybody know? You do realize it's mostly going to be about money. They don't want you to know what you don't know. And so I would continue to push. Now, you and I spoke quite a few times. Your
Right,
circumstance is, it's not a necessary about what's covered or what's available. It's about provider availability for
right,
coverage. That is a
right.
little bit more challenging. That is where it gets. So here's a thought that I could ask is do a little AI research on maybe highly recommended providers for the type of services that you're seeking, or again, to search and seek help for those people that are in your area specifically on the best providers that might provide you the type of services that you want to have, but maybe provided through another resource. I think you're getting Cobra coverage for a while longer. Correct me if I'm wrong.
I have Cobra, but the Cobra after the next 6 months becomes very unaffordable for me.
Yeah.
And from what I've been told is that basically HIP is now the equivalent of Medi-Cal. That's why they have covered California.
I would not take that as I'm going to tell you, I'm going to disagree with that from expertise. There's a HIP program. You just need to find it and see if your HIP would cover the Cobra. Or see now, and I don't know that 100%, but I will look a little bit more into California. I love that
Was
you're
I-
here. I hope I've helped you. I don't know.
No, you have. I
Yeah.
actually even spoke to an insurance agent today to ask him, how do I go about this? And even he's kind of at a loss with what to do.
I would just keep asking. You're doing what you need to do. And actually, it's interesting. I'm glad you're here. You and I've talked a couple of times. Your
Yeah,
circumstances, yours, you you appeal to a broader community. Nadia, do you mind if I share a little bit about your circumstance to the
sure.
broader community? Nadia lost her husband. And we've talked as a resource team conversation, and it's her husband insurance is covering this for a period of time graciously. Correct me if I'm wrong, but that's going
Yes.
to come to an end, and that she's going to have to figure out how to provide that ongoing coverage. And I'm going to suggest it's going to end up probably being Medi-Cal. But the problem is that Medi-Cal doesn't have access to some clinical supports or clinics and services that she has had under the private insurance. So glad to see you on here. We love you, we see you, we know you're here, okay?
Thank you. Thank you for your help.
Yes, always, always. A great great start to the quick Q&A. I'm gonna see if anybody else wants to jump in and ask a question.
I'll just say real quick, from personal experience, it can be really overwhelming to start this process, and you can
It
feel
can
like
be.
you're just going to hit roadblock after roadblock after roadblock, but just keep doing it, and eventually you will reach out for help, find someone who has done it before, who can just, help guide you and walk you through it, even if it takes you a little bit. But as far as HIP is concerned, one of the things that we really recommend too is make sure that prescriptions are included in that, because people are being denied if they just send their EOBs, and that doesn't include your medical prescription. So make sure if you apply for HIP that not only are you including all of the EOBs in there for your individual with Angelman syndrome, but also the prescriptions, because we were denied once and then we were approved for because we had left off the prescriptions.
Yes, these people that are doing this are actuaries, so they have insurance company have actuaries, so they're going to look at dollars and cents to the penny, right? And so they're trying to do a cost benefit analysis. Is the benefit of paying your premium outweigh the cost of not having you on that insurance? And the truth is, typically, yes, always. And so the more that we do this, the more that we're going to be better served. Trust me. And I love that you brought that point up. It's always like I say this like be present where you are and just look to solve a new thing today. Like there's never going to be a perfect this journey is not about having a perfect answer to everything. There's not, okay? And it's not about finding the perfect thing, because there's not like this oasis, this beautiful situation that's going to come out of this. No, it's messy and it's ugly at times and it can get a little tough. But if it helps you improve overall quality of life, take it, grab it, and run with it completely. Yeah. Great. Well, this has been great. Thank you guys for letting me do this. I got to introduce my new acronym. I hope you liked it. So everybody remember it? Don't be afraid to use the ASS acronym. Don't be one, but make sure you're a pain in somebody's if they're not giving you what you want. Okay? Appeal, seek help, and search to solve the problem. And that's really what we're all about here is we've got to do those things when we're getting denials and we're being told no. Just keep trying to solve the problem by searching.
Thank you so much for being on here, Dr. Wright. We just appreciate you. I don't know what our community would do without you. So many families. We're so appreciative. And if anyone has any questions at any point, please reach out to us. We're pretty accessible for the most part. And then I think our plan is to do, 2 of these a year with Dr. Wright so he can so we can jump back on. So it's overwhelming. Y'all are all doing a great job, and you've got a great person here that can actually steer you in the right direction, which not a lot of communities have. So we appreciate it.
Thank you very much. I appreciate it. This is something I'm very passionate about and always glad to help if I can. I can't solve everybody's problem, but I'll point you in the right direction. That's for sure. Okay. Y'all have a
All
great
right.
day.
Thank you, everyone. We appreciate you guys.
Thank you all.